Hello, bonjour, Quay. Thank you all for being here. I have a bit of an echo. I want to begin today's meeting by taking a moment to reflect on and to acknowledge that the space we occupy today. There's a bit of an echo in the room. Just seeing if that's. Sorry about that. Oh. Sound check. Sound check. Sound check. Sound check. Okay, sorry about that, everyone. We're just going to continue. So good evening. Thank you for being here. I want to begin today's meeting by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who live and continue to live on this land. I would also like to recognize and honor the valuable contributions of the First Nations, Inuit, and Métis people who call this land their home. When we acknowledge the land, we remember unceded means that First Nations people never ceded or legally signed away their lands to the Crown or to Canada. When we speak of traditional territory, we speak of land they or their ancestors traditionally occupied and used. The land sustained them, and as stewards, they cared for the land and the waters that flowed through them for generations before their lives were changed through colonization and forced assimilation through the residential school system. In the spirit of true reconciliation, reflecting on truth and reconciliation this upcoming Orange education. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination. Can we get the roll call, please, Madam Board Secretary? Vice Chair.
Present.
Member King?
Present.
Chair Kitts? Here.
We have quorum, Madam Chair.
Thank you. We have no regrets this evening. Are there any declarations of interest? Seeing none, are the Item 7.4, 2025 budget planning and considerations for Ottawa Public Health. We will hold for a staff presentation. Item 7.5, 2025 Ottawa Board of Health meeting schedule. Controversial. Is this received? Thank you. Item 7.6, 2024 operating and capital budget Q2 Board of Health for the City of Ottawa Health Unit Status Report. Is this item received? Thank you. And then item 9.1, appointment of Associate Medical Officer of Health. If members have questions, we will go in camera for this. But if not, we can receive the item now. Is this received? Great, thank you. So we will return to item 7.1, which is my verbal. So once again, thank you all for being here this evening. As we welcome one another back to our first meeting following the summer break, I would like to acknowledge our newest member, Waneka Ajeffer. And Waneka is a social worker and holds a Master of Social Work degree. Her over 15-year career in social work includes working as a psychotherapist, case manager, and in community outreach. She plays a very active role in community mobilization by promoting the principles of the Canadian Multiculturalism Act in her Nigerian community in Ottawa. Waneka has been on many committees, including Lanark County Situation Table and Youth at Risk of Lanark, Leeds, and Grenville. She has served as an executive member in many of the associations in her Nigerian community, and she is a guest lecturer at Dalhousie University. Welcome, Waneka, to the Board of Health. We know you're joining virtually today, but we look forward to meeting you in person when you can. And furthermore, I would also like to acknowledge the resignation of our fellow board member, Dr. Brown-Shrevs, who has been an invaluable member of the Ottawa Board of Health. Dr. Brown-Shrevs' commitment to serving the public and advocating for health equity has been truly inspiring at the board, and we are immensely grateful for the time she devoted and expertise she shared to the betterment of public health. Thank you, Dr. Brown-Shrevs, for your outstanding contributions to the Ottawa Board of Health and for being a true champion of public health. I will keep members of the board informed on the recruitment process for new public membership, as Ottawa Public Health staff is actively working with the clerk's office on recruitment and selection. I want to share some good news about the Healthy Babies, Healthy Children program. The HBHC program, which is funded by the Ministry of Children, Community and Social Services, is a specific service within OPH's Healthy Growth and Development program that supports children ages 0 to 5 and their caregivers. Through this program, OPH provides home visits by nurses, a social worker, and lay home visitors, and referral services for parents and their children. The HBHC program supports parents to have what they need to give their newborns and children a healthy start in life. SBO a constaté une forte augmentation des demandes de visite à domicile et de services sans rendez-vous de la part des parents ayant de jeunes enfants, dont bon nombre sont de nouveaux arrivants au Canada ou appartiennent à des communautés racisées et présentent de nombreux facteurs de risque. La demande est si importante que SBO doit constamment donner la priorité aux familles présentant le niveau de risque le plus élevé. Earlier this summer, the Ministry of Children, Community and Social Services provided an update to our Healthy Growth and Development team with excellent news of a 16.5% annual increase to the base funding for the HBHC program to Ottawa Public Health. This is a over $902,000 annual increase, bringing the HBHC base budget to $5.4 million this year. This investment will help stabilize the program and address inflationary and salary pressures, which have existed for over 10 years. We are deeply grateful for the ministry's attention to this important issue, and we were pleased to welcome Minister Parsa earlier this summer to visit one of Ottawa Public Health's neighborhood health and wellness hubs, where we spoke about supporting new parents and young children. We look forward to continuing our collaboration with the ministry to find innovative ways and models to expand the reach and continuity of services to improve access, reduce costs, and improve health outcomes for the youngest of our residents. In August, I participated in the Association of Municipalities of Ontario annual general meeting in my capacity as chair of the Ottawa Board of Health, and was joined by many of my council colleagues and Board of Health members. Ce fut une excellente occasion d'échanger avec des dirigeants municipaux de toute la province, de partager des expériences et des idées pour améliorer nos communautés, mais aussi de soumettre des questions et des possibilités aux représentants élus et aux décideurs du gouvernement provincial. Housing affordability, mental health, and substance use health were all topics top of mind throughout the conference. This year, the OPH team and I were able to engage with the Deputy Premier and Minister of Health, the Minister of Children, Community and Social Services, the Parliamentary Assistant to the Minister of Municipal Affairs and Housing, and members of the NDP and Liberal caucuses to raise issues important to Ottawa Public Health and the City of Ottawa. This included discussing the critical connection between health and wellness and housing stability, the work to strengthen the public sector in Ontario, including the future of the funding formula for public health units and the important role public health plays in mental health, addictions, and substance use health. In these conversations, we always hear how much our partners appreciate the constructive and strengths-based approach brought forward by the OPH team. Je me réjouis à la perspective de poursuivre le dialogue avec les décideurs provinciaux afin de veiller à ce que SPO bénéficie du soutien nécessaire pour promouvoir et protéger la santé et le bien-être de l'ensemble de la population d'Ottawa. National Day for Truth and Reconciliation is dedicated to the profound, painful impact of residential schools and to honor the memory of missing Indigenous children, their families, and the survivors of these colonial institutions. It also serves as a call to advance reconciliation and foster relationships with Indigenous communities across Canada. Observed on September 30th, the National Day for Truth and Reconciliation also coincides with Orange Shirt Day. This day, established in 2013 by Indigenous leaders, aims to raise awareness of the enduring effects of residential schools on survivors, their families, and the community. La journée du chandail orange commémore l'expérience des pensionnats afin de témoigner du parcours de guérison des survivants et des membres de leur famille et de leur rendre hommage, ainsi que de souligner notre engagement commun en faveur du processus de réconciliation en cours. One of Ottawa Public Health's strategic goals is to promote well-being and reduce harms as it relates to mental health, addictions, and substance use health. Key elements of this work are suicide prevention and the promotion of substance use health. As part of this work, Ottawa Public Health recently participated in World Suicide Prevention Day and the Working on Wellness Festival coordinated by CAPSA held just this past Friday here at City Hall. Santé publique Ottawa assure avec fierté la coordination de prévention du suicide Ottawa, qui met en œuvre des initiatives visant à prévenir le suicide et à trouver des solutions grâce à la collaboration de nombreux partenaires communautaires. Suicide Prevention Ottawa is comprised of local leaders who have been working together since 1989 to build a community without suicide in Ottawa. As the convener of SPO, OPH coordinated the event to commemorate World Suicide Prevention Day on September 10th. This event provided examples of important work being done to prevent and respond to suicide. An example of one of these initiatives is the Youth Nominated Support Team, a program that supports youth at risk of suicide, where our most recent data showing a significant decrease in suicide ideation for youth after 6 weeks from the program implementation. This program is delivered in collaboration with the Parents Lifeline of Eastern Ontario, the Royal, and Ottawa Public Health. Ottawa Public Health also participated in the 3rd annual Working on Wellness Festival on September 13th. This festival is coordinated by Community Addictions Peer Support Association, CAPSA, and brings substance use health, mental health, and physical health communities together under one tent to support wellness for all people. The commitment of so many people coming together to decrease harms from substance use is inspiring, and I want to thank board members and council colleagues that stopped by to show support. This concludes my verbal report, and I would be happy to take any questions. Seeing none, is this received? Thank you very much. Okay, we will head to item 7.2, which is Medical Officer of Health verbal report.
Good afternoon, Quay, Dasakut, and bonjour. I am recovering at the tail end of a respiratory illness, so I might have some cough. I thought I would join you virtually to avoid you having to experience that. Je suis en récupération d'une maladie respiratoire, alors je suis en ligne. And I will begin by inviting the team to provide you with an update on the 2024-2025 respiratory season. some relevant timelines there. And then I will touch on areas of focus for Ottawa Public Health right now, including childhood immunization surveillance and an update on consumption and treatment service sites and Overdose Awareness Day. So right off the top, I'd like to invite Dr. Laura Burns, who is one of the Associate Medical Officers of Health with Ottawa Public Health, to present to you about the upcoming 2024-25 respiratory season. I believe she will be there in front of you.
Influenza and RSV, COVID does not follow a typical seasonal pattern, and we see waves at different provides more details on fall and routine immunizations. One of the key products of Ottawa Public Health's epidemiology and surveillance team is the respiratory and enteric surveillance dashboard that ensures our local healthcare providers and community continue to be informed about the circulation of and risks of respiratory viruses in our community. For health communications, Ottawa Public Health continues to work with partners and collaborate on health communications with neighboring public health units and local hospitals to increase the reach and consistency of respiratory illness prevention and mitigation messaging across the region. The Infection Prevention and Control Team supports respiratory season preparedness messaging for long-term care homes, retirement homes, congregate living settings, schools, and childcare settings. Supporting congregate living settings through the provision of education sessions and outbreak support for these settings remains a critical component of Ottawa Public Health's work.
For emergency preparedness, Ottawa Public Health recently hosted a respiratory season readiness exercise with internal and external partners to discuss roles and identify planning and response readiness gaps to mitigate risks and enhance continued collaboration across all sectors. Partners expressed their appreciation and the importance of coming together as part of preparedness activities for the respiratory season. One of the priorities of Ottawa Public Health's community engagement team is engagement with community partners and supporting the dissemination of plain language and multilingual resources in the community, including to those in equity denied groups and in Quintile 5 neighborhoods. The team shares their experiences as well with the community with partners to address potential barriers and identify gaps and/or needs in the community. Recognizing that severe outcomes of respiratory illness disproportionately affects some populations, we are focusing our efforts and support to these groups in our strategy. Our programs have already begun engaging with high-risk populations in our community. Ottawa Public Health's Health Equity, Diversity, and Inclusion team continues to work with other OPH teams and through partnerships and with liaisons to disseminate information and provide immunizations with a focus on those who may be at higher risk of severe outcomes, such as older adults and those who may be facing barriers to accessing information and services, such as due to language, or those in shelters experiencing homelessness who often face a number of health issues and barriers along with homelessness. Examples of some of the initiatives include presentation as well as presentations to settlement agencies and work with these agencies to reach parents of young children and older adults who are new to Canada. Working with long-term care homes, retirement homes, and congregate living setting partners on outbreak prevention, management, and support remains crucial to decreasing morbidity and mortality from respiratory viruses. As residents of these facilities are often some of the most vulnerable in our community, and as we saw during the pandemic, a population who experienced some of the most significant impacts. The regional IPAC hubs are also important partners in this work. Multiple channels are used to ensure the community remains engaged and informed on respiratory illness in Ottawa. In addition to the Ottawa Public Health Respiratory and enteric dashboard that I mentioned, where we provide weekly updates, interpretation and key messages from the dashboard are provided on various social media platforms. Targeted respiratory communications have or are going out to schools, childcare centers, long-term care homes and retirement homes, and congregate living settings in Ottawa. With the start of the school year, a letter from Dr. Etches providing important reminders about respiratory illness season, fall vaccines, and routine vaccines went out to school boards to distribute to families. Coordinated communications to the community via social media, web, advertisements, media events, and collaborations with local partners is also occurring throughout the season. Healthcare provider communications are done through a number of methods, including public health alerts to provide time-sensitive information, OPH's physician and nurse practitioner newsletter, and through tables that OPH attends with local hospitals and healthcare providers. We want to thank you for your attention and continued support of Ottawa Public Health's work to decrease the impact of respiratory illness in our community. Thank you.
Thank you very much.
Yeah, I'll return to the rest of my verbal, if that's okay, Chair.
Yes, go ahead.
All right, but appreciate that, Laura. And Ottawa Public Health, I guess I'm going to switch subjects to another piece. I mentioned the childhood immunizations because we are mandated to review immunization records of children attending school or daycare and to make sure those records are up to date, and we call that immunization surveillance. So this is a topic we're raising now to the attention of parents and guardians. We need this information so that we can quickly determine which children are protected and which children may potentially be at risk in the event of an outbreak. And so this year, Ottawa Public Health will review student records for 7 and 17-year-olds. That's people born in 2007 and 2017. Starting in early December, families with children whose records are not up to date will receive letters from Ottawa Public Health about which vaccines are required. These letters provide information on how to access immunization services, how to update records, as well as notice of the risk of suspension from school if information is not updated. And a second notice sent out in the new year will include the date when suspensions would begin if records remain incomplete. The goal with this immunization surveillance is to promote population-level immunization coverage rates that protect individuals and school populations. And the letters aim to provide parents and guardians with time to access those immunizations required or share their information with us so that students are not suspended. And Ottawa Public Health will be working closely with school boards, with parents and guardians to update the records and provide access to vaccine services. L'objectif de la surveillance de la vaccination est de joindre les parents afin de mettre à jour les dossiers de vaccination et d'éviter la suspension des élèves. Mais le but ultime est la protection de la population. So vaccination services are available through community primary care providers and also at Ottawa Public Health Main Clinic, our neighborhood health and wellness hubs. We can address questions through our virtual immunization clinic, and certainly there are others as described in our immunization report and the Kids Come First network that are helping people catch up. And to the last subject around substance use, I had the privilege of attending the International Overdose Awareness Day in August. The theme this year, Together We Can, really highlighted the strength found in unity. People were gathering to remember and honor individuals, families, friends, service providers, really so many people affected by this persistent crisis. It was evident that the shared efforts to reduce stigma and shame, to treat everyone with respect and compassion, and to advocate for meaningful improvements in community well-being and mental health and substance use health are more important than ever. Everyone attending came with different stories, experiences, and perspectives on the crisis, but what brought people together was this shared We're one You can receive alerts about emerging trends and issues in the substance use world and drug supply. This reporting is continuing and it will inform solutions. We'll add that open substance use in public places in Ottawa will continue unless people have somewhere safer to use substances, whether inhaling or injecting, and unless people have access to mental health and addictions treatment when they need it. So the Ottawa Overdose Prevention and Response Strategy continues to highlight how important having a place to live is for decreasing the harms of substance use. Therefore, we're pleased to see recognition of the need for deeply supportive housing paired with mental health and addictions treatment in the recent provincial announcement investing in homelessness and addiction recovery treatment hubs. Ottawa Public Health is working with local partners to explore the funding opportunity presented to increase access to these deeply needed services. You know, a top priority for us is prevention, as well as reducing harms that people experience from substance use, including alcohol. And with the recent provincial update allowing beer, cider, wine, and ready-to-drink alcoholic beverages to be sold in convenience stores, grocery stores, big box stores, more places, Ottawa Public Health will monitor the social and health impacts of this change. We don't yet have information. This change just happened 2 weeks ago. But we are continuing to offer prevention programs with a focus on children, youth, and young adults to reduce the risk of harms associated with alcohol use. The programming includes support for new families through the Healthy Growth and Development Program, school-aged curriculum supports and resources through our School Health Online platform, and partnerships with agencies such as Rideau Wood and Le Cap, who offer programming directly in schools, including substance use prevention workshops and addictions treatment. Ottawa Public Health Party Safer workshops and training can be accessed on the Stop Overdose Ottawa website. And this program is being used in high schools and post-secondary institutions to build skills and strategies to reduce the harms associated with alcohol, in particular, and other substances. Nous continuerons également à travailler avec nos partenaires pour mieux faire connaître les repères canadiens sur l'alcool et la santé, afin de promouvoir et de protéger la santé et le bien-être de nos résidents. We will keep sharing Canada's guidance on alcohol and health to inform decision-making. Lastly, I would like to take this opportunity to add my thanks to the Harm Reduction and Substance Use Health team for the work they do. One of our partners, the Pinecrest Queensway Community Health Center, recently presented our team with a Community Leadership Award. So congratulations, team. I know your work makes a difference every day. Merci beaucoup. Ça conclut my report verbal, and I'd be happy to take any questions.
Thank you, Dr. Etches. Member Dudas.
Thank you very much, Chair, and thank you, Dr. Etches. While I appreciated the entirety of your report, I particularly was interested in your comments regarding the provincial announcement and the changes to the consumption treatment services that are across the province, but particularly impacting our city. And you touched on some very key points in your report on what is anticipated with the provincial changes and how Ottawa Public Health is supporting community partners to apply for the Heart Hub funding to increase access to treatment and to other important supports. It's incredibly important that we ensure the province is aware of how Ottawa is responding to this news and these anticipated changes and what it's doing to available services in our community. Therefore, with the committee, with the board's support, I am bringing forward a direction to staff that the medical officer of health, right,
recovery and return. My question builds upon Councillor Dudas's intervention just now. And you did address it in your very eloquent remarks on International Overdose Prevention Day, which I think were very well received by the community writ large. Fundamentally, individuals are seeking healthcare when they go to a consumption treatment site. And those individuals who were seeking treatment or are seeking treatment currently at Somerset West will need to go somewhere. And certainly within our community partnerships, there are no doubt strategies being developed in terms of the other consumption treatment sites which will still be in play as of new fiscal. So I'm just wondering if you could elaborate a bit more on your engagements with our community partners, whether it's Sandy Hill or Inner City Health, or even with our own team on the potential impacts of the closure here in Ottawa, and what they're thinking about in terms of continuing to help those individuals who need the care.
Yeah. So absolutely, our team is there working alongside and hearing from people who use these services, partners who deliver these services. And there are concerns for sure that the people won't get the support they need. Like you mentioned, the healthcare supports, support with basic necessities. Plan for something they don't want to see happen, right? Like, I think people are being realistic and they're looking at ways to increase, for example, outreach supports, more supports for people outdoors where they may be more. We have good examples. I mentioned one of them today, the block leaders, where people with lived and living experience are leading the way to find things that will work for them. And I think that needs to continue. We'll expect that to be the case, that solutions will be developed with people who are using substances, but and also neighbors. You know, I think we're hearing from businesses and neighbors that they also want to see things improve, and they're a bit concerned about what could happen. So we are still in the early days of actually developing a plan that would cross the communities most affected. But I hope that gives you a little bit of sense of some of the dialogue so far.
Thank you. Yes, thank you.
Confirm with the board that the 2025 meeting schedule report and the recommendations in the confidential in-camera report are approved. Receive. I know. Serves me right for trying to make a joke. Okay, so we're approved. We're good. Okay, great. Okay, so moving on to item 7.4, 2024 budget planning and considerations for Ottawa Public Health. My apologies. First day back. We're going to go to item 7.3, update on Ottawa Public Health's 2024-2025 immunization plan. Any questions? Yeah, go ahead, Member Bauer.
Thank you, Chair. And thanks to the staff for the plan and the previous presentation during Dr. Edge's report. It was a very comprehensive plan. I had a question around COVID-19 immunization rates, the coverage across the Ottawa population. It may have been covered in a previous meeting. And if so, I apologize, but I was wondering around the uptakes of our population in the last round of COVID-19 immunization and how that may be influencing or affecting our fall rollout once the new vaccinations come online in October-ish?
Yes, thank you. I think you're right. There isn't a specific percentage coverage in our report. So I'll invite epidemiologist in the room, I think, to speak to this, what we're seeing. Compared to flu, I think we reported on the coverage for flu because that comes in later by survey after the fact. So we can't even tell in real time what's happening with influenza coverage. So very happy to see with flu last year, 85% of older adults did get a flu shot. That's great. We want that to continue. Less than half of the whole population, when you look at the eligible population, were vaccinated against flu. So there's room to improve, especially because it does affect children. We want children to realize there's value in flu shots. For COVID, we have more information on the coverage and the distribution of vaccines. So maybe I'll leave it to someone in the room there to share a bit more information of what we're seeing with COVID. I would say similarly that the higher coverage rates are among older adults, though, with less uptake across the population. So I'll pause.
Sure. Thanks, Vera. Just to mention that we do have our COVID vaccination dashboard that continues to be refreshed on a monthly basis. And we see on our dashboard that since September of last year, we have a total population coverage of about 85% for at least one dose and 82% for a completed primary series. In addition, we saw that with the rollout of the fall campaign starting in September 14th of last year, we saw uptake of 23% of the population receiving a dose since that time period, an additional dose since that time period.
Thanks, and thank you for that. Very helpful. I just have one additional question, and I know it wasn't covered in sort of the core immunization plans, but very cognizant of the uptick in monkeypox. And I know the health team was out during Pride Week and doing great work with community partners on monkeypox vaccination. So just wondering how that fits into sort of our fall rollout strategy and where that's at the moment.
I think that is the Mpox vaccine is something we're continuing to promote in a more focused way to the populations that are eligible. We've been working on our website to try to make sure it's very clear which populations are eligible, because there have been more inquiries lately with what's happening overseas. But we are continuing to make points of access available and working with our partners, so Max and AIDS Committee of Ottawa. But I would, again, I'm not there in the room, so I can't catch someone's eye to see if perhaps you want to add a bit more, Marie-Claude or Kira.
Thank you, Dr. Etches. You've covered it. So we are continuing definitely to promote Mpox vaccination, and we are making it available at our sexual health center and working with different partners. As you mentioned, we did do a specific clinics during Pride Week in partnership with Max Ottawa. So we are continuing.
Thank you.
Thank you, Member Bauer. Vice Chair Giovanni.
Thanks. I would echo Member Bauer's congratulations on the thoroughness of the report. I think it's great. What wasn't clear to me is how OPH is bundling their vaccine efforts at the wellness hubs, the neighborhood wellness hubs. I think we learned a lot out of COVID in terms of decreasing any barriers for vaccination. And so knowing that, this fall there'll be COVID, RSV, as well as flu vaccines, is the intent that when the team is out in these wellness hubs, that all three plus any routine vaccines are being given at the same time where that's appropriate, to just really make sure that we're lowering the barriers, recognizing that having people go into pharmacies can sometimes just not be a comfortable place for them. So just wondered if you could comment on that.
Yeah, when you stop and think about it, it's a lot for the nurses, right? To manage all these different vaccines, even the transportation and keeping them in the cold chain. It's impressive that the team is making multiple vaccines available at once. Marie-Claude, did you want to confirm the plan if we can continue to do that through the fall?
Yes, absolutely. Yes, so we are continuing to offer all the different vaccines in our neighborhood health and wellness hub. As you mentioned, there are a great access point for people who have barriers in accessing and may not be able to access through other ways, different vaccinations. So the routine vaccine, as well as the respiratory season vaccines, including COVID, influenza, RSV, will be available at all the neighborhood health and wellness hubs, as well as nurses to be able to do immunization assessments. So some people may come with records from arriving here from different countries. So nurses are able to do assessments and able to provide the necessary vaccines.
That's excellent, and thank you. I can just appreciate the coordination that needs to be able to do that safely, recognizing as Dr. Etches said about the different requirements. And I don't know. I guess it's an innocent question if many public health units are having that approach, but I think it's something that we might want to evaluate, because I do think there's a nugget there it's a good way of really reaching the highest risk individuals in our community. And so if there's an evaluation component, I'd love to see that piece as well.
Thank you.
Yeah, I appreciate. We'll take that back. We have been doing some ongoing informal and formal evaluation of the hubs, and we're continuing to add to that. So the collection of social determinants of health data as well, to understand who exactly we're serving in the hubs. That's part of it too. So we'll take a look at what else we can learn.
Great work. Thank you.
Thank you, Vice Chair. I'm not seeing any other hands. Was that item received? Great. Thank you, everyone. Item 7.4, 2025 budget planning and considerations for Ottawa Public Health. We do have a staff presentation, so we'll just give them a moment to get settled.
Good afternoon. As we kick off the 2025 budget process, the OPH team is presenting a budget consideration report today. And this report is designed to be informative and marks the first time that we are introducing such a report ahead of the formal budget tabling. Our goal is to offer a comprehensive analysis and insight into our financial health, especially as we navigate a transitional year shaped by the province's efforts to revise Ontario's public health standards, changes to the public health funding formula, and the merging of several public health units. We have identified key triggers and pressures to the medium-term financial outlook, while also focusing on 2025 budget. So in my presentation, I will walk you through the key highlights of this report. The budget process begins by identifying key budget pressures. The OPH's financial challenges stem from historical underfunding, along with our ongoing efforts to meet priority needs by reallocating resources based on emerging priorities. In 2023, Ottawa Public Health reinvested $9 million through a service review and cost efficiency exercise. Today, We continue to review non-compensation and staffing priorities to optimize our resources. This year, we have identified two categories of budget pressures that impact our 2025 budget, as well as medium-term financial outlook. We have estimated that $2.3 million will be required to maintain current service level in the 2025 fiscal year. However, please note that this is a very preliminary estimate. We recently learned that we will require maybe $1 more million in addition to $2.3 million. Though we are still working with our corporate partners to finalize a more accurate figure. So please treat this figure with caution. The majority of this pressure is driven by the cost of living adjustment, a salary increment. We have also estimated approximately $9.3 million required to address growth pressures from fiscal years 2026 to 2027, driven by increasing demand for public health services in Ottawa, as well as the need to support the City Council's strategic priorities. Now let's have a look at our revenue growth outlook. The Ministry of Health continues to offer 1% growth in base budget annually, which equates to around $400,000. The Ministry of Health is also conducting a provincial funding formula review, which is expected to impact our budget starting in 2026. So that's why I mentioned that 2025 is a kind of a transitional year for us. The Ministry of Children, Community and Social Services has increased the base funding for our Healthy Babies, Healthy Children programs by $902,259 annually. And additionally, the city's proposed budget direction report outlines a 4.4% increase in the city's contribution to OPH budget, which amounts to approximately $1.25 million. Despite some revenue growth, we face ongoing challenges as our revenue falls short of the expenditure required to meet growth pressures. The key areas where growth pressures continue include infectious diseases, inspections, immunization coverage, chronic disease, mental health, emergency management, and maintaining a healthy environment. We shared with our board several times through a couple of reports on some of these pressure areas. Meanwhile, our remaining programs and service capacities following the reallocation of positions back in 2023 are limited to address increasing demand. Now, finally, given the immediate budget pressure and revenue growth scenarios, OPH is working to present a maintenance budget for 2025. We have multi-pronged strategies to offset budget pressures. For example, we will utilize the provincial base funding growth 1%. We will also incorporate the increase in HBSC base funding. We will also need to reallocate costs such as not contributing to an information technology reserves in 2025. To elaborate this further, that we traditionally contribute $200,000 to our information technology reserve, and that may not be possible next year because of the budget pressure. Additionally, the municipal increase of net contribution for 2025 OPH budget will also offset a portion of our 2025 budget. We are currently in discussion with our counterpart and see how can we address budget pressure using municipal contribution. So until we present our budget in November, we will continue keep our chair updated on the progress of our efforts to balance 2025 budget. Thank you for your attention. I'm happy to answer any questions.
Thank you, Kibria. Have any questions? Vice Chair.
Just a quick question, I think, around the IT reserve that was referenced. Is that for evergreening of equipment, sort of for that operational piece, or is it, to fund innovation and a future health record initiative?
Thank you for the question. It's for both. So the idea behind creating this reserve was to address any pressure related to any innovative technologies or use of the IT. We had been using this for last few years to address ongoing pressures with regards to using new technologies, softwares, and digital strategies. So currently we have a balance in the reserve. I cannot share how much is it right now, but I can share later. But next year, looking at the budget pressure, this would probably be one of our strategy not to contribute. Otherwise, we have to address additional $200,000 pressure.
Okay, thank you. I guess I'm just sort of thinking about the risk of having dated technology and what that introduces for staff retention, as well as potentially cybersecurity and whatnot. But we can talk about that more in detail upcoming. Thank you.
If I may add, Chair or Vice Chair, you're right. We're looking at all the risks and what the tools we need to do the job, and there's no question we need investment in information technology. Certainly the city is introducing more and more measures to protect against cybersecurity attacks, so we appreciate that. Also, I know this board has advocated for communicable disease tools, for vaccine registries. These are very important digital solutions that would be driven by the provincial level, not something we would develop locally. And what we've been really clear about in our recent discussions with the ministry is to implement provincial systems takes resourcing that we do not have at the local level. So any introduction of new provincial tools needs to come with implementation supports and even maintenance support. So that's something I think we've seen and will continue to, as a whole public health field, try to negotiate also with the province.
Thank you. Thank you, Vice Chair. Member Kavanagh.
Thank you, Chair. In terms of the 1%, is that being offered across the province to all public health agencies or public health boards?
Yes, this has been offered across the province, and they started providing 1% from last year as part of the ministry's strategy to strengthen public health, and they announced that they will continue this for 3 years, and it will end when ministry will finally launch the new funding formula.
Are they expecting us to stop some kind of programming that we have? Because obviously 1% doesn't cover inflation costs and cover all the programs. Are they expecting us to reduce services?
Thank you. It's a good question. as I indicated that our uh, our ongoing challenge stem from historical underfunding, and ministry historically never gave us an annual increase that really can cover even let alone the program growth, just the COLA pressure. And we are in this situation today. When we discussed with the ministry about funding formula review, we certainly raised this as an issue, that their annual funding increase, it does not reflect the other triggers for budget pressures. For example, inflation, COLA, population growth. And I expect the ministry will consider all of these factors when they launch a new funding formula.
Thank you. The chair mentioned the beginning about some good news with the Healthy Baby program, which is kind of like, this is the pattern I'm seeing, that funding for particular programs. We're seeing any other possibilities of funding for a program specific?
For 2025, the only conversation that they had with us is about funding for RSV program, funding for a COVID-19 program, but there is no certainty how much they want to consider COVID-19 as part of our base funded programs. They would like to consider a pressure through addressing a pressure through in-year allocation. So we need to forecast how much pressure we expect because of COVID-19 vaccination program, and they will address case by case. But there is no commitment from the ministry, any base funding for COVID-19 or any other things.
And so I will just add that we're also seeing some willingness to support catch-up on immunization. That was very positive. And we will continue to make pitches to the province about how we can help. So I think we have shared priorities with the province, and we have skilled staff and things we can do. So, you know, that's part of Kibria's approach as well, is to continue to look for ways we can grow our work.
Thank you.
Thank you, Member Kavanaugh. Member King.
Thank you, Chair. And just a point that dovetails on what Councillor Kavanaugh was speaking to. I just really want to show appreciation to staff for examining within budget mechanisms ways to finance wastewater surveillance initiatives. You know, to Councillor Kavanaugh's point, we see small amounts of funding added, but programs taken away. And I would just like to acknowledge the work that staff has undertaken to determine where feasibly and operationally possible the potential to fund that wastewater surveillance through delegated authority. But of course, that delegated authority impacts the municipal segments of our budget. Notwithstanding that, I really do want to thank the strong advocacy that has been undertaken by both staff and our chair around seeking more funds for public health. We require those funds. We just continue to see those pressures. And obviously we need more dollars from the provincial government to address the challenges that we have in the city. But I really wanted to thank staff for their efforts within the context of our own budgets that are constrained, and also the work of the chair, who I know has been to multiple meetings, intergovernmental meetings, where she's been making the asks on behalf of this board and the city. Thank you.
Thank you, Member King. I'm not seeing any other hands. So I did just really want to thank Kibri and the team. I know there has been a tremendous effort to identify pressures and reallocate resources to top priorities. A tremendous effort. I feel like that cannot be overstated. And we are appreciative for the historical support from the city on cost of living adjustment so that we can maintain and not reduce services as demand grows. But clearly, the advocacy to the province must continue with respect to updating the funding formula so that we can maintain the standards that they have set for us. And OPH has had to make hard choices, like how much we can invest in mental health, which we know is critical to support infectious disease work. So we don't want to keep making those tough choices. And I appreciate the transparency about what we could be facing in future years. So definitely more work to do. But I want to thank you for the work that's been done to date. So is this item carried? Carried. Thank you very much. We will move along here. Motion to adopt reports. Member Power.
Thank you, Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled as follows: Update of Ottawa Public Health 2024-2025 Immunization Plan, 2025 Budget Planning Considerations for Ottawa Public Health, 2025 Ottawa Board of Health Meeting Schedule, 2024 Operating and Capital Budget Q2, Board of Health for the City of Ottawa Health Unit Status Report, and appointment of Associate Medical Officer of Health in camera personal matters about an identifiable individual, reporting out date, upon council approval, be received and adopted.
Is this carried? Carried. Thank you. Motion requiring suspension of the rules. Seeing none, are there any notices of motion? Seeing none, confirmation bylaw, Member Bauer.
Be it resolved that the Board of Health approve, oh, sorry, the wrong motion. Here we go. Be it resolved that confirmation bylaw number 2024-3, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of September 16, 2024 be read and passed.
Is this carried? Thank you. Do we have any inquiries? Seeing none, the meeting is adjourned. Our next meeting will be Monday, November 4th at 5 p.m. Thank you, everyone. Have a great evening.